Thank you so much. And I'm going to take my mask off my earring. Okay. Hi. Everyone brought papers with their thank you speeches, and I don't have one. So I'm going to look a little bit on my phone. I'm Eve Bloomgarden, and that was a really nice introduction. And I can say that story is entirely true. I did call you. I did scare the living daylights out of you. And, you know, we were the second state to shut down. So I think it was certainly, we saw that you got things done for us. So we're very grateful. And I'm here representing the entire team of IMPACT, which is the Illinois Medical Professionals Action Collaborative team. And that includes my fellow physicians and co-founders, as well as other healthcare professionals, nurses, pharmacists, research analysts, and our amazing students who actually get most of our work done. So I wanted to tell you a little bit about who we are, and we already heard a little bit, but we're a grassroots coalition of all volunteers who got together in March 2020 to try and activate change and maximally support our healthcare workers and the communities that we live in and that we serve by amplifying both our healthcare worker voices as well as the public's concerns during the pandemic. We do this mostly by leveraging social media as well as traditional media outlets and by novel partnerships across the state and across the country. We make statements like Jonathan talked about. We write op-eds. We have a spot on the local news weekly. We do national academic talks across the country as well about our work here in Illinois. We put out, we have a blog. We put out impactful chats on YouTube, and we develop infographics with our volunteer student team to try and debunk misinformation, which has been the true other pandemic happening since the start of COVID. You know, it's not a new thing, but it's certainly something that no one really anticipated, this breadth of misinformation where we're constantly fighting ourselves here and prolonging the pandemic because, you know, because the truth is often hard to recognize, especially with the rapid sharing of information on social media these days. And so that's one of our big focuses. You may have also seen us just showing up at school boards, especially here, and on PTO Zooms, and thanks Tracy for listening to us and letting us, me and Hala especially, you know, come and bother you with all of our concerns about school. But, you know, we're so privileged really to live in this area and have the benefit of being able to have a governor and a lieutenant governor and attorney general and school board leaders and representatives who really follow the science. It's unique, and our work really is because we knew, I know, it's unbelievable in a pandemic that this is a unique and not a guarantee, but truly, I mean, healthcare workers, this has been a hell of a 2 years, right? And I think we have colleagues across other states who really don't have the kind of support that we have here, and we're very lucky, which is why we've been able to lead the way in you know, showing people how to really face this pandemic. And we've had many challenges in these last 2 years that, you know, no one, I don't think, really could have envisioned them all coming at the same time. But we appreciate the ability to handle it with grace and to know that our leadership is listening to both us and to science and to really following a moral compass that doesn't deviate from our own. So we're grateful. And I just wanted to end with this area in the Northfield Township, we were able to put together a volunteer army, we call it, of 1,700 people we call them our vaccine army, to go out and help at vaccine clinics throughout the Chicagoland area, some of which we fully organized and ran at IMPACT. And we were involved in vaccinating over 100,000 people in Illinois. And this was really spearheaded by Dr. Barnia, who's with us on Zoom right now. And she also lives in the Northfield Township, as do I. In the Glenview and Northbrook area alone, we helped organize and staff 10 events, 5 for the first dose and 5 for the second, at Glenbrook South High School, where we were able to vaccinate almost 3,000 kids, or 3,000 people, mostly kids. And we showed up there to provide information and to provide our infographics and to be available for anyone who had questions, concerns, or fears about the vaccines or about COVID in general. So for us, this has really just been therapy. It's been a way to keep our own mental sanity. We're all full-time physicians still working. We're all parents. My children, one is in preschool and the other is in District 28 right here. So I'm very grateful that she was able to get through kindergarten and now is in first grade in person. And we are incredibly lucky. Thank you, Tracy, and to everyone for that. And, you know, we're trusted messengers in the community, and as we enter the next phase of this pandemic and moving forward, there's tons of work to be done. We've heard a little bit here about gender equity and how important that is, healthcare for all, that healthcare is a human right that needs to be extended, and we're going to continue the fight. We'll see where it takes us, and I'm so grateful to accept this on behalf of the whole team. Thank you.
Thank you, Jonathan, and thank you.